Hare Krishna. It's my great opportunity to connect with all of you, dear Vaishnavas. At Bhaktivedanta Hospital, we have a beautiful healthcare system called the integrated healthcare system, whereby the specific needs of our devotees can be addressed in a very practical manner. The Vaishnavas, the devotees, have a very typical lifestyle. For them, Mangalarti in the morning, 4:30 is important. For them, preaching programs to attend and to preach in the community is important. There are various services in the temple. Then we also have late night programs. Sometimes we have late night festivals, correct? And our prasadam, of course, which is has to be the best, is full of sweets and fried carbohydrates, high on taste, high on spiritual value, but sometimes low on nutrition. And through all of this, we have our families, we have our personal stresses, we have our various complexities of life which we all have to deal with. Through all of this, trying to live a God-centered or Krishna-centered life, somehow or the other we find over there, I was seeing that our health seems to go into the background. And it is not surprising where suddenly, before too long, you realize that, oh, I have got a fatty liver. Oh, I have become a diabetic. Oh my God, I have got a high blood pressure. Oh, my knee joints are paining. My God, I've been getting repeated migraine attacks, and now I'm getting a lot of backache, right? So in this way, these metabolic and these chronic disorders will creep in without our knowledge. And sometimes even more complex issues of allergies, skin disorders, dementias, Alzheimer's, it can then go and progress into some of these chronic domains. And therefore, at Bhaktivedanta, what we have tried to do is that we would like to, rather than having a disease-centric approach, that means in modern medicine, they treat diabetes, they treat hypertension, they treat cancer, etc. Rather than having a disease-centric approach, we have been using a patient-centric approach to find out what are the various factors which have led to the causation of the disorder. That means what is the patient's stress factors, what are the patient's lifestyle, what is the patient's food habits, what are the patient's sleep patterns, what are the patient's family situations, what are his job situations, how much does he exercise, etc. So when we look at all these factors, what is his family life situation, right? What are other comorbidities he's been having? What is his past history, right? So when you look at all these things together, then we evolve the actual pictures of what led to the disease. And then we have a care model, is an integrated care model, whereby various pathies will have different roles to play. For example, we will have modern medicine, which will help us to define the problem through imaging, through lab work, to precision in terms of what actually has gone wrong and to what extent the disease has affected the body. For example, how much is the grade of the fatty liver? Is it grade 1, grade 2, grade 3? For example, how much is the level of diabetes? What is the HbA1c? Is it 8, 7, 8, 9, 6, etc.? So we can actually objectively find out the data as to where does the health stand. And through that methodology, the standard of care and allopathy is useful. However, we will not just stick to allopathy. We will also expand to different modalities which are useful for chronic disorders. And therefore, for example, Ayurveda will have its own value to play in the patients. By doing Nadi Pariksha, we can understand, and through Veda pulse analysis, we will see how much is the Vata Pitta dosha balance, how much is the aura, how much is the chakra variations in the 7 chakras, how much is the metabolic stress, how much is the Ojas Shakti in the present in the body. So through that, we will devise particular medical therapies, either through Panchakarma or through medications or through various procedures. We will also use the modality of homeopathy, whereby we can understand what are the psychosomatic issues happening. For example, stress and family situations and relationship issues and hidden fears, anxieties, insecurities can affect us in ways which we don't even understand. And that can really lead to disease. So homeopathy will try to modify that and bring that to level whereby the psycho-neuro hormonal axis can be again rectified. Of course, we will also use another system called as nutritional balance, whereby various nutritional supplements can be used nicely to bring back the cell into its proper metabolic state, to bring about proper homeostasis in the body. We will also use yoga, whereby we can improve flexibility, bring about more peace, use pranayam also, whereby we can improve the prana shakti and improve the balance between the parasympathetic and the sympathetic nervous system. Of course, not to forget sleep. And devotees have late nights and early mornings. And therefore, the crucial 7 hours of sleep where melatonin is released in the body right from 8 to 9 p.m. and then it peaks up between at 12 o'clock and then early morning, of course, it starts falling as the sun rises in the east. right? So devotees can sometimes miss out on the crucial night sleep, and therefore the sleep efficiency may go down, and that leads to what we call as chronic inflammation in the body, and leads to increase in vata and disturb pitta, and can lead to a lot of degenerative changes in the body, other in form of cervical spondylitis, lumbar spondylitis, arthritis, and various such degenerative disorders can start. And therefore, we use Veda pulse analysis to look into that dimension. Over the last few years, we have been having many wonderful Vaishnavas who have graced the hospital and taken advantage from all over the world, from Australia, Portugal, from Belgium, from UK, and of course from all over India. Many of our worshipable sannyasis, GBCs, senior brahmacharis, and of course community members, grihasthas have come, and with complex issues which cannot be adequately addressed to the modern medicine system, and have been significantly benefited by this, what we call as a 7x healing system, consisting of Ayurveda, homeopathy, yoga, breathing, lifestyle, sleep, and stress management. So we have, through this system, we've been able to tackle most of the problems. In fact, even complex disorders like dementia, which some of our senior Vaishnavas have gone through, have been taken care of, and their focus has been to improve what we call as the overall quality of life and prevent further cognitive decline. So that has also been taken care of in our senior Vaishnavas, who are now Prabhupada disciples in the range of 75 and above age group. Of course, the goal of all this is Vaishnav Seva, right? Our hospital was built on the foundation of Vaishnav Seva, Varnashram Dharma, and Vaishnav Prachar. And therefore, for us, our greatest joy is to have our Vaishnavas come to an environment which is conducive to healing, where doctors are devotees, nurses are devotees, Prabhupada's Kirtan is going on constantly, the deities of Sri Jagannath Swami are there, and the atmosphere is very conducive towards uplifting the body and bringing it to the healing process. Integrated medicine, which we are practicing, is philosophy where we try to heal, we try to heal, and through the healing, we try to bring about good health, and through that health, we create a sense of mental and physical happiness. And when that sort of happiness and peace prevails in the consciousness of a person, in the devotee's mind, and then he's able to perform better in his Krishna consciousness. And therefore, it helps us towards the ultimate goal of Samsiddhi Haritoshanam. Dear devotees, our mission is to deliver compassionate, patient-centric care by integrating modern medical science with time-honored healing traditions, addressing the root cause of disease while nurturing physical, emotional, and spiritual well-being with integrity, excellence, and evidence-based practice. We are fortunate at Bhaktivedanta to have created a beautiful team of 5 experienced personalities who are handling different dimensions of the integrated model. We have the Ayurvedic Dr. Memane Nirmal Chandra Prabhu, who has 25 years of experience of postgraduate medical practice in Ayurvedic science. And he's not only the head of department, but we have an entire floor dedicated to all sorts of complex Ayurvedic treatments, Shirodhara, Panchakarma, Udvartan massage, leech therapy, Potli massage, etc. So all sorts of complex treatments of Ayurveda can be done, and the entire dedicated department is there on the 5th floor of the hospital. We also have Dr. Kirti Mutreja, who is the expert on homeopathy. As I said, she is the one who actually is specializing in homeopathic psychiatry. And therefore, devotees may sometimes have complex psychological and emotional issues, which can also be handled. And we've been having very good success. Some of our devotees who come with these sort of issues, manifesting the body as allergies or disturbed skin issues, and affecting the various internal organs like kidneys and heart. So all this can be unraveled by taking care. So Dr. Kirti is very good at managing the homeopathic dimension. We have Madam Vaidehi Navathe, who's 30 years experience. She is the national level nutritionist expert, working on the level of advisory to the Indian Association of Nutritional Medicine. And she is also the head of department of nutrition in our hospital. And through her knowledge, we use the dimension of ahar, or food, as a very important means of changing the internal physiology of the patient. Because oftentimes chronic disorders have inflammation as the root cause, and therefore prescribing specific diets to different patients, especially addressing inflammation, has been a very important part of the healing process through the ahar conception. Of course, we also have Mr. Rajesh Kadam, who is Ram Sharan Prabhu. His expertise is in counseling, and he has been for the last several years counseling young and old people with complex relationship issues, psychological issues, addictive problems, etc. And therefore, people who have been going through various situations in their families and how that has been affecting their health, that is a damage which is oftentimes neglected. But we also address that by having a separate session for counseling through Rajesh Kadam. Of course, myself, I represent the allopathic side. My name is Dr. Dhaval Dalal, Dwarkadhish Das, and I lead the team. And my experience of the last 35 years in practicing postgraduate medicine as being a teacher of medicine in the hospital, my experience helps me to really sort of amalgamate all the various dimensions of health and explain this in a very proper way to the patient and derive a proper plan which can actually be more convincing for the patient to go through the entire treatment model and inspire them to fix their health in a particular way, in a nice way. Therefore, this team works in coordination. It's like like a musical orchestra where each musical instrument is working in symphony to create a beautiful, nice environment. No one system predominates, but we all work together as a beautiful team. So that's been our system of working together. And the goal, of course, is, and we often say in Krishna Consciousness 6th chapter, Yukta Hara Viharasya, Yukta Chestasya Karmashu, Yukta Sapma Bodhasya, Yoga Bhavati Dukhaha, right? So we say this often, we speak it often, we read it often, but oftentimes devotees may not practice that in their life. So we would like to encourage them to really take up this sloka more seriously, and we'll help them to really integrate with their Krishna consciousness, with their devotional services, with their purificatory processes of life, to integrate health as an important dimension, to live a balanced life, a wholesome life towards wellness, happiness, and good Krishna consciousness. So we are a tertiary care hospital, and along with all the model facilities which would be there in a tertiary care setup, we also now have introduced for the last few months robotic surgeries, which are especially used for gynecology, oncology, and general surgery. So we have expertise in trained doctors who can use this facility as well for more complex surgeries which may require robots. That's something which is also being offered now to the public and to the devotees. So, dear Vaishnavas, finally, we request you that if anything any way we can help you, please contact us on the ISKCON, the Devotee Healthcare Service panel. There is a available helpline 24/7, and you are free to access these facilities. As I said before, we do not want you to get sick, but in case somehow you do get sick, we are here at your service to serve you. Thank you. Hare Krishna.